Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today's topic is fatty liver. I want to start simple. If your ultrasound says fatty liver, but you feel completely normal, is that nothing or is that already a real problem?
It's already a real problem. Fatty liver means fat is sitting inside your liver cells. The newer medical name we use now is MASLD. That stands for Metabolic Dysfunction Associated Steatotic Liver Disease. We changed from the old name NAFLD because most cases are linked to things like extra weight, high blood sugar, high cholesterol, and high blood pressure, not only alcohol.
So, fatty liver has a new name.
Yes, MASLD is the big umbrella. Inside that, there's a more serious form called MASH. MASH means the liver is fatty, the liver is inflamed, the liver cells are getting injured, and scar tissue is starting to form. That scarring can keep going toward fibrosis, cirrhosis, and even liver cancer.
Let's slow that down. Can you walk me through the levels, like stages, in normal language?
Yes. Think of 4 steps. Step 1, simple fatty liver. There's fat in the liver, but not much inflammation yet. Step 2, MASH. Now the liver is irritated and inflamed. The cells are getting damaged. Early scar is starting. This is the stage where we get worried about long-term harm. Step 3, fibrosis. Scar tissue is building. We grade it in stages F1, F2, F3. When someone is in moderate to advanced fibrosis, like F2 or F3, their risk of serious problems is higher. Step 4, cirrhosis. That's heavy scarring. The liver gets stiff and weak. At that point, people can get a swollen belly, confusion, bleeding problems, and a much higher risk of liver cancer.
People always ask this. Why did I even get fatty liver? I don't drink that much. So why does it start?
Most of the time, it's not only alcohol. It's metabolism. The main drivers are extra body weight, especially belly fat, type 2 diabetes or insulin resistance, high triglycerides and abnormal cholesterol, high blood pressure, processed, high sugar, high calorie food, low activity, and poor sleep. And genetics does matter. Some people just store fat in the liver very easily, even if they don't look very big on the outside. So it's not only how big you look, it's how your body handles sugar and fat.
Who should really worry? Who is high risk?
If you have type 2 diabetes, you should take fatty liver seriously. If most of your weight sits around your stomach, if you have high blood pressure, high cholesterol, or high triglycerides, if you drink alcohol regularly on top of those risk factors, the liver can get damaged faster. And if a doctor ever told you your liver enzymes are a little high, you are not fine. You're already in the follow-up group.
I want to ask about family. Is fatty liver related to genetics? Like, if my parents have it, am I more likely to have it too?
Yes, we do see fatty liver run in families. We often see the same pattern repeat: belly weight, high triglycerides, type 2 diabetes, blood pressure, and fatty liver. So 2 things are true. Number 1, lifestyle still matters. What you eat, how active you are, how much alcohol you drink, how well you control sugar. And number 2, some people start closer to the danger line because of their genes. So if fatty liver runs in your family, you should screen earlier, even if you feel fine.
Patients always ask, what are the symptoms of fatty liver? What does it feel like?
This is the scary part. Most of the time, you feel nothing. No strong pain, no fever, no warming. You can have fat in the liver, inflammation in the liver, and even early scar in the liver and still feel completely normal. By the time you feel late signs like a swollen belly, yellow eyes, easy bruising or bleeding, or confusion, that's usually cirrhosis. At that point, we're already late.
So if I can't feel it early, how do you even diagnose fatty liver?
We do it step by step. Step 1, we get suspicious. Maybe your routine blood test shows high liver enzymes, things like ALT and AST, or maybe you have diabetes plus belly weight. That combination alone is a red flag. Step 2, we look at the liver. An ultrasound can show fat in the liver. That's how a lot of people first hear the words fatty liver. But ultrasound can miss mild cases. It's helpful, but it's not perfect. Step 3, we check the scar level. Now we ask, is there fibrosis? Is there scarring yet? We can do a special scan called transient elastography. People often call it FibroScan. It's like an ultrasound that also measures how stiff the liver is. Stiffer usually means more scar. We can also calculate a number called Fib4 using your age, liver enzymes, and platelet count. If that number is high, it means you may already have significant scarring and you should see a liver specialist. Step 4, biopsy. We do not biopsy everyone. We usually think about biopsy when we believe there's real inflammation and scarring, and we need a clear answer.
I want to ask something very direct. What happens if someone ignores fatty liver for years?
3 main dangers. First, cirrhosis. Scar keeps building. The liver gets hard and weak, and it can start to fail. Second, liver cancer. Once you reach cirrhosis, your risk of liver cancer goes up. People with cirrhosis need regular screening for liver cancer, usually every 6 months with imaging. Third, heart and blood vessel disease. This surprises people. The number 1 cause of death in many people with fatty liver is not always liver failure. It's heart attack and stroke. Because the same metabolic stress that hurts your liver is also hurting your arteries. So this is not just a liver thing. This is your whole body risk.
So it can end with cirrhosis or liver cancer and even heart attack or stroke. That's serious.
Exactly.
Now, treatment. If you tell me I have fatty liver, what happens next? Do you just say, lose weight and send me home?
No. We make a plan with 2 tracks, lifestyle and medical care. Track 1 is lifestyle. This is still the foundation. Weight. Even about 5% weight loss can start to lower fat in the liver. Around 7 to 10% weight loss can calm liver inflammation and can even improve early scar in many people. More than 10% weight loss can actually clear that active, angry liver stage in a lot of cases. Food pattern. Less sugary drinks, fewer constant junk snacks, less fried, salty, packaged food, more vegetables, fruit, beans, whole grains, nuts, seeds, lean protein, healthy fats. The same food that protects your heart also protects your liver. Movement. Regular physical activity makes your body more sensitive to insulin and helps pull fat out of the liver, even before huge weight loss. Alcohol. If you already have inflammation or scar, we tell you to strictly limit alcohol and sometimes stop completely. Alcohol plus metabolic stress speeds the damage. Control the rest. We also work on blood pressure, blood sugar, cholesterol, sleep, and stress. All of those are part of fatty liver care. It's one system.
That sounds like work, but what if lifestyle is not enough? Do we finally have real treatment, or is it still no medicine, just diet?
We finally do have medical treatment, but it's not for everyone. There are now prescription options for certain adults who already have the dangerous form of fatty liver, the kind where the liver is inflamed and already starting to scar. This kind of treatment is not something you buy yourself. It's started and monitored by a liver specialist. You still have to do the lifestyle work: food, movement, alcohol control, blood sugar control. So the medicine is an add-on for higher-risk patients, not a replacement for healthy changes.
So yes, medical therapy exists now, but only for people with real liver damage and only under real follow-up, no self-medicating.
Exactly.
Let me ask how to protect the liver before it gets to that scary stage. How do we prevent fatty liver or stop it from getting worse?
Here's the prevention mindset. Keep your waist under control. Belly fat is a high-risk shape. Control blood sugar early. Insulin resistance feeds liver fat. control blood pressure and cholesterol. Your arteries and your liver are connected. Move your body most days, not just on weekends. Limit alcohol. And if you already have fibrosis or cirrhosis, avoid alcohol completely. And get checked if you're high risk. If you have diabetes, high triglycerides, or you carry weight in the belly, don't wait. Ask to be screened. Catching scar early can stop it from turning into cirrhosis and liver cancer later.
Okay, now a very practical question. If I already have fatty liver, how often do I need to follow up? Is it see you next year, or is it more serious?
Follow-up depends on how much scar you have. If you have simple fatty liver with no big scar yet, we usually repeat blood tests and metabolic labs every 6 to 12 months. We also repeat simple scoring tools like FIB4 over time to make sure scarring is not quietly getting worse. Some people repeat imaging, like ultrasound or a FibroScan type liver stiffness check every 1 to 2 years, or sometimes every 2 to 3 years if you're stable and low risk. The goal is to watch the liver, not just wait for symptoms. If you already have moderate to advanced fibrosis, stage F2 or F3, or you're receiving specialist-directed therapy, we follow you more closely, often every 6 to 12 months, to see if the liver stiffness is getting better or getting worse. If you're in cirrhosis, now you're in a high-risk zone. You need regular specialist visits, and you need liver cancer screening, usually every 6 months. For life.
So, I feel normal is not the plan. The plan is measure, track, follow up.
Exactly.
Before we close, talk directly to the person watching this who's thinking, I'll fix it later, I'm busy.
Please don't wait. Fatty liver can stay quiet for years, and then suddenly you're talking about cirrhosis, transplant, or stroke risk. The good news is this is one of the few serious problems in adult life where you can actually turn the curve if you respect it early, with weight change, food change, movement, alcohol control, and blood sugar control. And if you already have real scarring and active inflammation, we now do have specialist-guided medical options. Check it, track it, respect it.
Give me the short summary in one breath.
Fatty liver, MASLD, means too much fat stored in the liver. The dangerous version, MASH, means fat plus inflammation plus scarring. That scarring can lead to cirrhosis, liver cancer, and it also raises your risk of heart attack and stroke, and you might feel completely normal in the early stages. We diagnose it with blood tests, ultrasound or FibroScan, and fibrosis scoring tools. Treatment starts with lifestyle. Weight control, healthier food, daily movement, alcohol control, and good blood sugar and blood pressure. For people who already have real scar and active inflammation, there are now prescription options, but only under specialist care. Follow-up is not one time. You keep checking every few months to every year. And if you have cirrhosis, you get liver cancer screening every 6 months.
Thank you, doctor. And thank you for watching Dr. Health Hub, where every episode begins with a doctor tip you can trust. Your health is your wealth. Stay tuned for the next doctor tip you can trust.
Medical education only. This video is not personal medical advice. If you're worried about your own health, please see your healthcare professional.